Hi, welcome to my presentation about supporting rural men's mental health and specifically my study, which was a pilot gatekeeper intervention. Hi, my name is Freya and I'm a student on the Master Science Counselling course at Bangor University. So in this presentation I'll be taking you through my research project, of which the chosen topic is rural men's mental health. So I was interested in this topic because I have personal connections with men who live and work in rural areas, in fields such as agriculture and arboriculture, and here on the slide you can see a picture of my partner doing his tree surgery work sat in a tree. So I never realised the severity of the issue around the mental health of rural men, so I wanted to do something about raising awareness of the issue. So just to give you a little bit of the background of the topic at hand, so men are at an increased risk of mental health distress and specifically suicide. So this is even worse for rural men, but there are specific challenges that rural men face that can make these mental health problems much worse. So that can include things like geographical isolation, so physical distance from where support is located in urban areas, but there's also the impact of the nature of living and working in a rural area, so the costs of agricultural work, changing climate and weather, so floods and droughts, etc., but also importantly government legislation, which especially in recent years has not been very helpful to farmers and has made it more difficult for them to gain a steady income. Some of the other barriers and challenges that rural men face include traditional masculine norms, which men may feel pressured to live up to. So this may be feeling the need to be stoic or emotionally restrained and not relying on other people. But additionally, there's also problems around stigma, so fears of being seen as weak if you do reach out for mental health support. So research has shown that when men do reach out, it's more likely to be to a friend or relative rather than a specialist mental health service. So therefore, a potential route for providing support for these men is to train these individuals to be gatekeepers. So whether that's friends or relatives or members of the community, it's a gatekeeper is someone who can point whoever is in need, say the individual in need, to where resources are and where they can find support. So based on all this information, what did our study intend to do? So we wanted to investigate a potential training intervention for those gatekeepers that we've just mentioned, so those key informal supports for rural men. So we designed an intervention that was designed to inform participants or gatekeepers of the context of rural men's mental health, specific challenges and barriers that rural men face, but importantly also increase their confidence, ability and likelihood to respond to signs of distress in the real world. So this study was conducted in North Wales, which is a rural area, and the hopes is that we could target individuals who may have male friends or relatives that they could offer support to. So participants for this study were all students at Bangor University. So importantly, why did we do this study? So the primary aim is to improve support for rural men and importantly encourage help-seeking behaviours by training the people that are around rural men. So how did we run the study? So participants that signed up to our study via the SONA system were first invited to attend a 1-hour training intervention which contained information about the issue of rural men's mental health, what gatekeeping is, how to act as a gatekeeper, such as response options, how to support other people, but also other elements such as shared stories from rural men who've had mental health problems themselves, and this was all underpinned by the Roots framework, which was developed specifically for this study. So after the intervention, participants 1 week later were invited to a 1-hour focus group which was semi-structured and was designed to gather information, gain insight into their opinions of the intervention, their opinions of the roots model, what they found useful, and whether they had any improvements for the study. So the roots model was developed to be a holistic overview of the main barriers that are faced by rural men. So R stands for the rural or geographic barriers. So this means the literal physical distance that rural men have from mental health resources, and includes things like travel time to these resources and how it's impractical for them to reach support given their daily routines and the nature of the work that they're in, long hours, etc. So the first O then stands for occupational or economic barriers. So, like mentioned before, this is things to do with the job itself, like the costs of agricultural work, things like running a farm and the costs that are associated with that, but also things like government changes to legislation and the lack of support from the government that is available to farmers, budget cuts, etc. So the second O stands for outlook or cultural barriers. So this relates to stereotypes around masculinity, feeling the need to always appear strong, to be self-reliant, phrases such as I should be able to handle this on my own, real men don't need help, etc. So T stands for the thoughts or psychological barriers. So this relates to masculine norms discussed earlier, but also importantly stigma surrounding reaching out for support, fears of possibly being viewed as weak. And then finally S stands for the social or relational barriers. So in rural communities, things like everyone knowing everyone, there is that sense of community, but it's almost like a double-edged sword. There's then the risks of gossip or fearing that people will know that you've reached out for support. What will people say? Things like that. So this roots model is to encompass all of the different barriers, key barriers that rural men specifically face. So what did we find? Following the focus groups, we created transcripts of participant feedback, and we performed a thematic analysis to identify the main things that were being brought up by participants, so the main themes, sub-themes within those themes, and then some example quotes to illustrate what participants thought and felt about the intervention. So we found three main themes with our thematic analysis. So the first theme is rural context as a barrier to men's help seeking. The second theme is increasing awareness of rural men's mental health. And the third theme is from awareness to action. And I'll now go into a little bit more detail of each of the three themes separately. So theme 1 is rural context as a barrier to men's help seeking. So some of the sub-themes that we found within this were things like isolation. So participants highlighted things like that the intervention made them consider. So for example, one participant mentioned the amount of hours that farmers may spend just sitting in a tractor alone, and that it highlighted to them that it is a very isolating job, and their typical jobs in rural areas are quite isolating typically. So another sub-theme identified was the lack of anonymity in rural communities. So participants highlighted that the intervention made them think about the fact that in rural communities, there is the theme that everyone knows everyone, and so men may feel like it's easier to just not say anything at all rather than go through the whole process of people finding out, people talking. Maybe they fear pity or being fussed over, so that could be a barrier to seeking support for rural men. And finally, the third sub-theme was masculinity and stigma. So participants highlighted that the intervention made them think about fears that men may have about being seen as weak for reaching out for support. So the second theme that was identified was that participants felt that the intervention increased their awareness of rural men's mental health as a whole. So some of the sub-themes associated with this main theme were that participants felt that statistics were really eye-opening. So in the intervention we included some quite shocking statistics that were meant to be quite powerful and really inform people about the severity of rural men's mental health. So participants came back to us and said that it really captivated them while they were listening to the intervention. Another sub-theme was the lived experience and relatability aspects of the intervention. So participants felt that they really liked hearing the stories from other rural men who have had mental health distress, and that really stuck with them, and that was a key takeaway for them. So the final sub-theme in this theme is recognising signs of distress. So participants felt that after the intervention they were maybe reconsidering or rehashing conversations with people, or maybe subtle actions that other people around them had taken, and maybe starting to realise that they were possible signs of distress. So they really felt that the intervention helped them to notice possible warning signs that someone may need some support. So the third and final theme that we identified in our analysis was from awareness to action. So this theme was all about relating to the confidence and how the participants felt about actually doing gatekeeping itself out in the real world. So participants felt that they had increased confidence to approach someone. So they felt that after the intervention the information was very fresh, and that they felt following the information they'd gathered they would be much more likely to reach out and support someone that they thought may have been in distress. Participants also felt that the intervention helped move rural men's mental health and the issues surrounding it as something more abstract, or that they just heard about, into actually something that's relevant to them and their contexts living in rural areas. So one participant in particular noted that the intervention made them change the way that they were thinking about their own male relatives, so their dad in this case. And then the final sub-theme is sustaining impact over time. So participants just felt that when the information maybe isn't as prominent in their minds, they may be more likely to neglect signs that someone may be in distress and may need support. So I've taken you through what we found in our study, but now it's important to consider what this means. So implications for our study, participant feedback, future directions for the study, and key outcomes and takeaways from the study. So participants reported that they felt that the intervention had increased their awareness of the issues and barriers specific to rural men. They also felt that they had increased confidence to reach out to rural men and gatekeep rural men in their own lives, and that following the intervention they would probably be more likely to reach out to rural men. So to us, this shows that our study met the intended aims. It improved awareness and increased confidence to respond, and that is exactly what we wanted to see from this intervention. So in terms of what stood out most to participants, they mentioned that shared stories were really prominent. Hearing about rural men who'd struggled with their own mental health struck with participants, but importantly they also valued the inclusion of those shocking statistics about men's mental health because they found them to be really eye-opening, but also they valued the balance between the statistical information and the shared stories, which moved it from more of an abstract issue, so maybe something you hear about in the news or online somewhere, to something that's more relevant to them in their own lives. So in the focus groups we also asked participants about what they thought about the roots model specifically. So participant feedback was that they felt the intervention gave them a really holistic view of rural men's mental health and gatekeeping, and they felt that this was encouraged by the roots model. So they felt that roots really covered everything that someone would need to know to support rural men and encourage help seeking. They also felt that the information was easy to digest, and that overall they found the intervention to be a really informative resource. So what does our study mean in terms of reality and actually putting it into practice? So, as our intervention seems to be performing as intended, there is the possibility that it has real-world applications and could be directly addressed with the target population, so rural men themselves. So, for example, there's a possibility it could be used in educational settings or specifically even agricultural colleges, so teaching the men themselves, these rural men, how they can support themselves, but importantly how to support each other, and just trying to remove some of the stigma that's surrounded with this topic. Additionally, it could also be used in community-based programs in rural areas to try and bridge that gap between the physical geographical distance that rural men have from support. So there were some improvements that were mentioned by participants in the focus groups. So they mentioned that there was a slight sense of information overload and that maybe the intervention would be better received if it was split into shorter, more spaced out sessions. Participants also felt that sometimes the slides were a little bit too crowded, and that links in with we could resolve that by splitting up the intervention and spreading it out and making it easier to digest. But also participants felt that they had some concerns about how well they would be able to retain the knowledge that they gain in the intervention, so they felt more confident immediately afterwards to act as gatekeepers, but they were worried how long this would last for. So they suggested that maybe some follow-up sessions would be beneficial, just to refresh the learning and give them a little pick-me-up about what they learned in the intervention. So something that participants highlighted that I think really stood out was the recommendations that could be included in future versions of the intervention. So participants highlighted that there is a heavy focus on what can be done to support others, but little to no focus on what support they could offer themselves. So, gatekeeping's been found to be mentally demanding. They wanted to know maybe how they could prevent burnout or support themselves while they're also trying to support other people. Participants also had questions about how they could gatekeep someone who may have had a negative experience with a mental health service, and how they could handle conversations around this and offer support appropriately in these situations. So there was very much a focus on learning how to properly balance supporting others but also looking after themselves at the same time. So in terms of future directions for the intervention, it could be that we implement a measure for gatekeeping, so to see whether there are actual quantifiable increases in gatekeeping behaviour. Linked to this, we could also investigate whether the increased confidence that participants reported leads to actual increases in the likelihood to respond, gatekeep, or encourage help seeking. Additionally, there's also the possibility of implementing a long-term checks to investigate the sustainability of the learning that participants had over time. So, what are the final takeaways for this study? So, I believe that this study really does highlight the importance of human connection and how we need to band together to offer support for one another, because if we don't, then, the things like rural men's mental health won't improve. I think it also highlights the importance of those informal supports, so friends, sisters, brothers, parents, cousins, extended family, whoever, and how important they are in reaching vulnerable groups and offering support to individuals such as rural men and people living in rural contexts. But also I believe that the present study demonstrates that there's definitely potential for the future of the intervention as a gatekeeper training resource, but also within that the Roots framework. But a final key takeaway would be to again emphasise the importance of creating support options for this hard to reach, often high risk group. So that brings us to the end of my presentation. I want to thank you for listening, and I hope that you have found it to be informative. I'm going to run over the references slides, which you can pause to read over if you would like to read further into anything that you've heard or has been of interest in my presentation.